Hello, I'm Dr. Stephen Blomerth, and you're watching Natural Health Today. This show is dedicated to natural health means of helping you get over probably 80 to 90% of the common everyday pains, because I think fully 80 to 90% of day-to-day pains that people have, that they go to their medical doctor and seek some type of drug or surgery, that type of thing isn't usually necessary, and they can be helped by what I call natural health means. And I think of it as 4 different avenues. One is manipulation of stuck joints, because when you free up a joint that's been stuck, there's all kinds of nerve flow that increases to areas, and that removal of the nerve interference and the restoration of normal movement has far-reaching effects, not only at the site where you might have some discomfort, but all over the body. Another means of natural health care that I think helps many people is when you have trigger points in muscles. And this is something that has far-reaching effects from the top of your toe down to the bottom of your feet. If there's a knot in a muscle, the only way to get it out is not necessarily by rubbing it, but by going back and forth over the area where there's restrictions to free it up. Once those restrictions are freed up, it's amazing the amount of function that returns. And when function returns, just about every pain that you can think of in your body will be diminished and feel better. The third means of natural health care that I think of is exercise. And I'm not talking about the stereotypical exercises that you see on going to the gym, but I'm talking about what we call stabilization exercises, exercises that restore your core so that you're able to have better posture. When you have the best posture that you can possibly have, there's not a single type of problem that isn't at least a little bit better from having better posture and having the stability to hold yourself upright. And the fourth, but certainly not the least by any means, is nutrition. I think nutrition probably has the largest long-term effect of anything that you could do for yourself. Poor nutrition is not just being overweight. People can have poor nutrition and not necessarily be overweight. But nutrition helps you repair, gives you energy to do the tasks that you want to do, and will prevent you from needing many of the drugs that medical doctors give are due to a person having poor nutrition. So when you write out a prescription for a drug, many times it's a permission slip to continue to have poor eating habits. So with those 4 avenues, natural health means can help many, if not most, of day-to-day healthcare problems. So I invite you to participate in the show and send in your question about yourself or a loved one. You can send your questions to us via email at pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155. Or you can send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll slightly disguise your name. So when we read it, your friends and neighbors won't be shocked about the problem that you might be calling in about. And we'll discuss natural health means of helping you. And if you can't be helped by natural health means, we'll mention that too. But let me put on my reading glasses, and let's have a look at some of the questions that have come in since our last episode. Okay, our first question is from Meredith. Meredith writes in from Denver. She says, "My daughter complains that her feet hurt her every week after her dance class. And last month she started complaining of pain in her back. Her pediatrician sent her for x-rays of her feet, and he said that her feet look fine and she just has growing pains. But she's still complaining. Do you think she's just trying to get out of her dance class?" Well, Meredith, I don't know whether your daughter is trying to get out of her dance class, but I do know that there's really no such thing as growing pains. It's kind of a catch-all term when people really don't know what's happening with a person, but particularly if they're young, they'll ascribe their pain to growing pains. It doesn't hurt to grow. But your daughter may have something as simple as a flat foot. When you take an x-ray, the x-ray doesn't show whether you have a flat foot. An X-ray just shows whether you have a fracture or you don't have a fracture, whether you have a tumor or whether you don't have a tumor, whether you have one less bone or one extra bone in your foot. X-rays are excellent for that. X-rays, in my mind, aren't bad. What they do is they rule out pathology, but they don't rule in what I would call functional changes, and having either a flat foot or a high arch, because a high arch can be just as bad for a person. High-tech solutions like X-rays and MRIs are great for spotting pathology, but they don't do anything to tell us about is there a change in function. And just having a flat foot doesn't even have to be a flat foot. It can just be a couple of joints in your foot that are a little bit stuck. If a couple of joints in your foot are slightly stuck, that will give you foot pain. If you have foot pain long enough, as your daughter may have had it for a while, if she's been taking dance classes, it changes the way you walk. If you change the way you walk, you might get back pain. You might get neck pain. You might get hip pain. But your feet are your foundation, and they should function as much as possible in a normal fashion. It can be something as simple as a stuck joint. It could be something as simple as a abnormally low arch, a flat foot, or a high arch. None of those things are really seen on X-ray. So a medical doctor can say, oh, your feet are fine, when they're not actually fine. They just don't have pathology. Pathology could be a break, a tumor, something like that. It's great to know that your daughter doesn't have that. She doesn't have growing pains. She can be helped by someone who is a little bit more versed in what we call biomechanics, as opposed to just the pathology that medical doctors look for. Whether she's looking to get out of her dance classes, I don't know. I'll leave that between you and your daughter. But Meredith, thanks for that question. Bill writes in from Middleton. He says, I keep seeing these ads for CBD creams to rub on your sore spots. Have you tried them? Are they any good? And how about taking CBD in general? Bill, I have tried a CBD cream, and the first thing that I noticed was it's not all CBD. It's a lot of other things in there. If you look at some of the CBD creams, there'll be menthol in there. There'll be camphor. There may be capsaicin in there. Those are the standard items that you'll see in many topical creams. Do I recommend topical creams? I don't recommend many topical creams at all. But many of my patients swear by them because they give them some relief. And relief is not necessarily a bad thing to do, but just about no cream that you rub on is going to change the underlying condition. So getting some relief is good, but it's kind of like a reprieve. In other words, it doesn't solve the problem. It just gives you a pass so that you don't have to deal with that problem. Now, I think it's much better to deal with a problem. Now, the CBD is a new item on the market, and it seems to be everywhere. Is it bad to have in one of these creams? It's not bad at all. Will it help you? It did not help me. That doesn't mean it might not help you, but you've got to remember, virtually all these CBD creams have many other items in there that may be giving you the effect. But even the placebo effect is good. If you believe in the CBD enough and it's in a cream and it makes your pain go away, who am I to say don't do it? Is CBD good for other things? Yes, it's good for many other things, but it should probably be taken in a form that you can absorb. CBD as an oil is not too well absorbed by your body, so you have to take a substantial amount of it. Now, a lot of people say, well, should I get the CBD from hemp? Should I get it from a cannabis plant? Should I get just straight CBD? When you grow an herb of any type, there's many different cofactors in it. If you just isolate one factor, for instance, CBD has a big name, so people say, well, just give me that. There's something called the entourage effect, where the other elements that exist in the natural plant have the ability to make that one element that we know about, that we've studied, work much better. So I'd say, if you're going to buy any type of CBD oil, get it from the cannabis plant so it has all the other factors in it, because all the other factors are going to be probably work more powerfully. The CBD work? Well, yes, it works for many, many people who have seizures and other conditions. So there is a place for it in the spectrum of treatment. It does help your cells work a little bit better because it boosts a nuclear, inside your cell there's a nucleus. It makes your nucleus put out proteins needed for healing much better than just about any other thing. THC, that does the same thing. In fact, it sometimes does it much better when combined. So is CBD good and THC bad? No, they're both good. In fact, if you have equal amounts of both of them, they'll give you a nice effect of decreasing pain and decreasing inflammation. CBD cream, I'm not too sure about, but if it helps you, it's certainly not a bad thing. Okay, Bill, thanks for your question. Jenny has a question. She writes in from Danvers. She says, I have neuropathy in my feet, so sometimes I have a little difficulty feeling the ground when I walk. None of the pills my doc gives me seems to help. Have you heard of anything new that can help? Jenny used a term that we might not all be familiar with. It's neuropathy. Just to break the word down for you, the prefix neuro just says nerve. Okay, it just so it means neuropathy is a problem with a nerve. Pathy just means pathology, so it means a nerve pathology. One of the most common things that some people have is what they call peripheral neuropathy. In other words, the periphery is your extremities, like your fingers and your feet. People can have a lack of feeling in their feet or their hands, or maybe a tingly sensation in their feet and the hands when things go wrong with their nerves. Many things can make your nerves go bad and fail to function normally. And so far, there are not too many drugs, if any at all, that'll bring that back. But good nutrition can help, and that can include B vitamins, eating right. But there are also some things that will give us neuropathy, and the thing to do is try to avoid those. Now, some people come down with neuropathy after cancer treatment. Cancer is such a dangerous thing for most of us that the chemotherapy drugs that we take, we know that they're not good for us, but they help kill off the cancer. Sometimes the side effects of the chemotherapy drugs can give us neuropathy. Not too much we can do about that because we're fighting a worse enemy. The cancer is a danger to our lives. The neuropathy won't kill you, it just makes your quality of life go down. But there are some drugs that are what I would call optional drugs, or some drugs we take we don't need. For instance, statin drugs. Statin drugs is a class of drugs that would include Lipitor. You might have heard of Mevacor. There's many different names for them. They're all, if your doctor says he wants to put you on a cholesterol-lowering drug, I would refuse that. Unless you're extremely sick, if you've already had a heart attack, and you're in danger of dying, the idea of lowering your cholesterol is very bad. One of the things that cholesterol-lowering drugs can do is give you diabetes. And another thing that cholesterol-lowering drugs can do is give you neuropathy. So if you don't absolutely need a statin, which is a cholesterol-lowering drug, don't take it. I have had patients who have peripheral neuropathy, and their doctor keeps them on the statin drugs, whether it's Lipitor or any of them, Crestor, many different names. But the cholesterol-lowering drugs are a grand hoax that almost nobody needs to take. Now, some people say, well, don't the cholesterol drugs do some people some good? They do, but it isn't by lowering their cholesterol. It's because the cholesterol-lowering drugs also can act as an anti-inflammatory. But you know, there's many other good anti-inflammatories. Just eating a good diet is a great anti-inflammatory. Just taking the omega-3 fish oils is a good anti-inflammatory. And those other things don't have the negative side effects. So if you're a neuropathy patient and you're still taking Lipitor, I would tell your medical doctor that you want to come off. Unfortunately, you can't come off instantly like that. You have to slowly lower the dosage. but it's a good idea if you are a neuropathy patient, you have less feeling in your hands or your feet, get off the statins, get off the Lipitor, the different names. Doesn't make any difference which name you have. Get off those drugs because they're not going to do you any good. And we'll talk at a later time of that cholesterol is essential. It's in every cell membrane of your body. It makes vitamin D, sex hormones, ubiquinone, and dolichols. We'll talk about that another time. But thanks for that question, Jenny. That was good. All right. Bob writes in from Danvers. He says, I work as a drywall plasterer, and so I'm constantly having to bend over and work in tight spaces, so my back hurts most of the time. I went to a doc last year, but all he wanted to do was to give me exercises. I get plenty of exercise all day long, so I can that advice. Do you know how to help people who work in construction? Because when you work in construction, you're getting exercise all day long. How can you be helped with that without these exercises? Well, let's see, that was Bob. You know, I've run into that many, many times. People who are in construction say, I don't need to do exercises because I'm working hard all day long. I'm getting exercise all day long. You know, exercise and work seem similar because they're hard on you. They make you breathe hard. It seems like you're doing something pretty substantial. In the summer, you are certainly sweating very hard if you're in construction, just like you might be sweating in exercise. But let's talk about some of the differences. In work, when you're doing work as fast as you can because many times the job calls for getting the job done as soon as possible. When you're exercising, you're not doing it as fast as you can. You're doing it in a slow, controlled fashion. So that's one thing. Work many times, if you work any particular job where you have to do a repetitive motion over and over again, that repetitive motion gets certain groups of muscles a heck of a workout. But it doesn't do what good exercise is supposed to do. Good exercise is supposed to work one set of muscles and the opposite. You know, let's talk about opposites. We know here's the bicep, here's the tricep. In a perfect world, we'd give just as much work to our bicep as we do to our tricep. That doesn't happen, and it definitely doesn't happen in a work situation. So when we talk about exercise versus work, they seem similar, but if you're going to get better, you need exercise as well as other things. Exercise is not the only thing that'll get you better. The right exercises help in addition, but getting better, particularly when people have low back pain that's of a gradual onset, there's many different things involved. Some of it will be, there are going to be some joints that are stuck. Some of it may be a problem with your feet. You might need to have your feet treated or have orthotics made for your feet. You might have trigger points in your muscles. All these things have to be worked on before exercises can help you. So a good exercise program is essential, but only when you've straightened out all the other things too, so that everything can work together. So Bob, exercise and work, they're not the same. I know working in construction is tough, but if you get a good exercise program that's combined with freeing up the stuck joints, working on the muscles, and checking out that you don't have flat feet or other conditions at your foundation, because foundation is important in construction and in your body. So, Bob, no program that's based solely on exercise will get you better, but without a good exercise program, no program can get you better completely and keep you the way because you want to be stable. Bob, thanks for that question. Let's go on to our next question. Okay, Marianne, she writes in from Danvers. She said, I saw your show where you talked about doing planks, but I can't do them because they hurt my shoulder. Is there anything else I can do for my abs? Yeah, Marianne, you're right. If you have a bad shoulder, and particularly if you're doing old-fashioned planks, what we call 6-point planks versus the 8-point planks that I demonstrated, it can be bad on your shoulder. And sometimes if your shoulder is bad enough, even the 8-point plank can be bad. So I'm going to show you a simple exercise. It's a little bit easier. on the surface than doing the 8-point planks, but it can be very effective for working your abs, and it definitely won't strain your shoulders. So let me take off my jacket, and I'll stand up to show you how to do this exercise. Okay, this exercise is called decompression breathing. And it seems like all you're doing is breathing, but you're breathing in a certain fashion that is really going to work your abs. What you want to do is you want to stand with your feet roughly parallel, the outside edges parallel, maybe a foot or two apart. And take your thumbs and put your thumbs, find your ribs here in front. And then plant your little pinky down here on your hip bone. And this position is called the measuring stick position. And you shouldn't do it with your shoulders way back like this. You should do it with your shoulders kind of going out, because the idea of this exercise is you're going to take a deep breath in. You're going to not only raise your ribs up this way, but think of your chest as a barrel. You're going to expand your ribs upward to the sides and the back. In other words, expand all the way around 360 degrees. And what you want to do is feel with your thumbs, in the measuring stick position, you're going to feel your ribs rise up. And a really full breath, so you're really expanding and elevating. And then you're going to keep that as you breathe out. That's the hard part. So breathe out. But keep the ribs elevated. Let's try that again. Breathe in. Feel your ribs rise out. Now breathe out and tell your ribs can't come back down. Have to stay up. Have to stay elevated. Let your air out. And while you're doing that, pull in your belly button, like as if you put on a pair of pants that are too tight. Let's try it one more time just to illustrate. Breathe in, elevating, expanding. Breathe out, pulling your belly button in. Now, if that's not difficult enough for you, there's another position you can do it in. You can do it with your arms up, way up over your head, as if there was a $200 bill pasted up on the ceiling and you're trying to reach it. So you just breathe in, breathe in, breathe in, raising your fingers, really stretching out as high as you possibly can, then breathing out, pulling in your belly button, but not letting your fingers down 1 inch, keeping your fingers up. If you're doing it right, you're going to feel a heck of a workout in your abs and in your back. Some people say, well, I felt it a little bit more here, a little bit more there. It's going to be different. But if you're not feeling it in your abs and your back, if it doesn't feel difficult, you're not doing it right. And again, the hardest part of it is not raising your ribs up. That's the easiest part. The difficult part is letting all your air out, all the way out, and pulling in your belly button and maintaining that position. So we've come to the end of the show because I run out of questions. And I'd just like to tell you that I'm Dr. Stephen Blomerth. You've been watching Natural Health Today. And I invite you to participate in our show by sending in your questions like our viewers did today. And you can send them in to us via email at pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155. You can send it in an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll slightly disguise your name, but we'll talk about natural health means of getting you better, because I think 80 to 90% of day-to-day problems that people have, that they usually go to the medical doctor, they get drugs or surgery over, don't need those types of solutions, but can benefit from what I call the 4 avenues of natural health care. So thanks a lot for watching. See you next time. I'm Dr. Stephen Blomerth. Thanks for watching Natural Health Today. Bye-bye.